You know that strange nagging pain that you just can't figure out? The one that doctors sometimes struggle with too? Well, today we're going to play detective. We're diving into a real-life medical mystery about a seriously debilitating foot pain and how modern medicine found a very, very surprising culprit. So, just imagine this for a second. Think of a nerve like a superhighway for signals in your body. But what happens if something blocks one of the lanes? You get a massive, chaotic traffic jam. That pain, that tingling, that numbness you feel, that's just the chaos from the blockage. All right, let's get into it. So, our story starts with a 56-year-old woman. She's not a professional athlete, no big history of injuries or anything like that, but something is going very, very wrong with her left foot. For 6 long months, her life is just completely taken over by this thing. It all starts with a feeling she describes as an electric shock right on the top of her foot. Weird, right? Then, by month 3, she can actually feel a lump forming on her ankle. And by the 6 months mark, the pain isn't just coming and going anymore, it's constant. It's messing with everything she does. Okay, so in any good detective story, the first thing you do is examine the evidence. The physical exam confirms it. There's a firm, lumpy mass there. But here's the key clue, something called a positive Tinwell sign. This is a classic move where the doctor just taps lightly over the mass and zap, it triggers that same tingly electric feeling all the way down the nerve. That is a huge flashing sign that the nerve itself is at the heart of the problem. So all the clues are pointing to a nerve problem. Now, to really understand what's happening to our patient, we've got to zoom out a bit and look at a concept that affects tons of people, from marathon runners to folks who work at a desk all day. It's called tunnel syndrome or nerve entrapment. Your body is actually full of these little natural tunnels where nerves have to squeeze through tight spaces. Most of the time, it's totally fine. But when that tunnel gets narrowed for some reason, the nerve gets squeezed, kind of like pinching a garden hose. The flow of information gets choked off, and that's when you start feeling the pain. So what's causing these tunnels to get so tight? Well, it could be a whole bunch of things. Repetitive strain from sports is a big one. Old injuries like ankle sprains that never quite healed right. Even something as simple as shoes that are too tight. Or, as you can see on this list, a space-occupying lesion, which is just the medical way of saying something is growing in there that shouldn't be. All right, so now that we know all about these tunnel syndromes, let's get back to our patient. The doctors have her story, they have the physical clues. Now it's time to put all the pieces together and crack this case wide open. You can really see the method here. They started with her story. That electric shock pain was a major hint. Then they followed up with the physical exam, which led them to the mass and that positive Tinel sign. So what's the next logical step? You've got to use technology to get a look inside her ankle and see what's really going on. And the best tool for that particular job is an MRI. An X-ray is fantastic for looking at bones, but an MRI, it gives you this unbelievably detailed picture of all the soft stuff. Muscles, tendons, and, most importantly for us, the nerves and any suspicious lumps hanging out right next to them. And there it is, the big aha moment. The MRI just cuts through all the guesswork. It shows, clear as day, a little fluid-filled cyst sitting directly on top of the deep peroneal nerve, physically squishing it. The traffic jam has officially been located. And our culprit even has a name, a ganglion cyst. These things are actually super common, and they're totally harmless, just little non-cancerous sacs of fluid that can pop up near joints. But in this case, it just happened to grow in the worst possible spot, right where it could pinch that vital nerve.
So, mystery solved. We know what it is, and we know why it's causing so much pain. Now for the most important part. How do you fix it? How do you clear that traffic jam and get the highway moving again?
Well, for most nerve entrapment issues, doctors usually start with what they call conservative treatments. You know, things like rest, physical therapy, maybe some anti-inflammatory injections to try and calm everything down and reduce the pressure. But when you have a clear physical blockage, like a cyst, and the easy stuff doesn't work, surgery becomes the most direct path to a solution. And for our patient, there was really no question about it. That cyst was the problem, plain and simple. The only way to guarantee she'd get relief was to go in, surgically remove the thing, and literally give that compressed nerve some room to breathe. And the result? I mean, a quote from the actual case study says it all. Immediate postoperative pain relief. The second that pressure was gone, the pain was gone. Just like that. 6 months of agony completely vanished. What an incredible outcome. Now, this patient's problem had a nice, clear, physical cause that a surgeon could just take out. But for a lot of people, the problem isn't a big cyst. The nerve is just inflamed inside its tunnel, and the treatment involves incredibly precise injections. And this is where medicine becomes a game of millimeters.
I mean, nerves are tiny. The one that was causing our patient's pain is small. But others, like Baxter's nerve, which causes a ton of heel pain, can be only 1 to 2 millimeters thick. That is incredibly small. Trying to get medicine right next to that tiny little target without a guide is just unbelievably difficult. So how do doctors get better at aiming?
Well, the answer is in the data. Look at this number. A really detailed study on cadavers found that a common nerve causing heel pain was found in a very specific tiny anatomical zone 81.4% of the time. It's not random. Our bodies actually have really predictable patterns. And this right here is the game changer. Knowing this means doctors can use simple landmarks on the outside of the ankle, things they can actually feel, like the tip of the ankle bone, to create a reliable map. It gives them a highly predictable target for their injections. It's like having a treasure map. But it's not just about where you aim. It's about how you get there. Using ultrasound, doctors can actually see the needle and the nerve in real time. And what studies have found is pretty wild. With one technique called out of plane, where the needle comes in at a steep angle, they hit the right spot 90% of the time. 90%. But with another approach, the in-plane technique, the success rate drops all the way down to 20%. It just goes to show you that knowing the anatomy and using the right technique makes a staggering difference. So what's the bottom line from all of this? Well, first, knowing the deep anatomy of the body is absolutely everything. Second, technology like ultrasound is an amazing guide that helps turn that knowledge into action. And third, technique matters a lot. It all proves that a vague, mysterious pain can have a very specific physical cause that you can actually fix if you just know exactly where to look and how to get there. So we've followed this whole journey, haven't we? From that first weird electric shock through all the detective work with the MRI to the incredible relief of surgery. And then we saw how that same idea of finding a precise location applies to the tiny world of injections. It really all comes down to understanding these hidden tunnels and pathways in our own bodies. That's the key. That electric shock, that numbness, that strange ache you might feel sometimes, it's probably not random. It's a signal, it's a clue from this incredibly complex system trying to tell you that something's wrong. So the real question is, are you listening?